Prime Minister of the country stops by at your stall and curiously asks you questions about what you've been up to and appreciates everything that you've built.
We are screening like millions of people. So I think the interesting opportunity and this platform that you are able to reach so many people, it's very exciting. At the same time, a lot of responsibility. This is healthcare. So you cannot make mistakes. Before joining Qure.ai was a buzzword for me. We've actually impacted around 16 million people.
Is AI also curing patients?
AI is, at least at this stage, is not out there to replace humans. It definitely plays a complementary role. We have learned how to deploy AI in remote corners of the world. Each day we screen people out there. We are screening like millions of people. I think we women doubt ourselves too much. And like I mentioned that feel free to experiment, to try new things, live for yourself.
Hello and welcome to a brand new episode of YO.DH, a space where we have conversations about digital health along with experts from the field. Well, YO.DH is an initiative of YOD, which stands for Youth Ownership of Digital Health, and is a community of young digital health professionals. And I am Kopal Khanna. I'll be your host for this episode. Okay, well, imagine this. You've been passionately working in a field for over 9 years, and you've been spending long hours, long days, building innovation, driving strategy in this particular field. And then one fine day, the Prime Minister of the country stops by at your stall and curiously asks you questions about what you've been up to and appreciates everything that you've built. Well, sounds surreal, but our today's guest has lived this dream. Sanya Chawla is the director at Qure.ai, and she has been building some revolutionary things in the space of digital health, technology, and AI. And well, today I get the honor to pick her brains and understand more about this space. Welcome, Sanya.
Thank you so much.
Welcome to YO.DH. How are you feeling today?
I'm feeling nervous. You mentioned experts.
Well, you are one. And I would love to, first of all, understand from you, Kia, how did that moment feel when the Prime Minister walked up to you and wanted to know more about what you've been up to in life?
So we were very lucky to have been selected for presentation with the Prime Minister. And even though we prepared for it and we knew that we have a few seconds, I was so nervous. You would have seen that in the video. So, but really grateful for the opportunity. It's great, presenting to the Honorable Prime Minister. We really got a minute, but we really wanted to draw attention to how AI can actually help in TB elimination for India. But it was a great moment.
Well, you've been doing some amazing stuff, so that was a very well-deserved moment. And just to kind of backtrack, first of all, I want to understand from you, what is Qure.ai? Like, if you can just break it down in the most layman terms for us, like, what is it?
So, Qure was started in 2016 by Prashant Warrior and a few other co-founders. We essentially a bunch of data scientists. They wanted to work in the space of AI. Identified multiple sectors, settled on healthcare. They also identified that chest X-rays are one of the most common imaging which happens in healthcare besides other imaging. So they said, why not, start building AI solutions on chest X-rays. So we started in 2016 and we've come really far. Now in 2024, we started with a couple of countries in Southeast Asia. Philippines was our first deployment. And now we are in around 82 countries. We have close to 2,100 sites where we are live. And we've actually impacted around 16 million people annually. And for me personally, seeing this journey, when we were 50 members, now we've grown to around 300. For me personally, it has been very inspiring. And a journey full of learnings.
Well, it's inspiring for me to hear that as well. So, of course, there's been a lot of buzz around AI, I think, especially in the last 1 year, where suddenly ChatGPT came into place and everybody's speaking about it. People like me are also using it, right? But somebody like you has been associated with it for a very long time. So, Sanya, just like as a layman, if I want to ask you, what is AI and what is AI, especially in the digital health space? What would you tell me?
So AI is artificial intelligence. So as compared to another program, where we do coding and, we explicitly kind of program that maybe the system has to generate a pre-defined set of outputs or, do some calculation based on certain rules. Artificial intelligence, on the other hand, are, algorithms, systems which can process huge amounts of data, can kind of learn from that data themselves and then generate, identify automatic patterns themselves. So it's not something which is explicitly coded, but once you kind of train the algorithm enough with huge amounts of data, it starts making those decisions automatically. So this is something as a very high level of what artificial intelligence is. And then there are a lot of different kind of models on how do you train a system. Can you train on images? Like we do, or on, like text, for example, your chat GPTs and have huge form of, background data and text, which is fed into. So depending on the nature of AI, that's how we kind of feed data.
And how roughly, like how long has the health care industry been associated with AI? Like can you tell me the number of years you've been working on this, for instance?
So I have been working with Qure for over 3.5 years now. But as I said, we started in 2016. Healthcare industry has been an early adopter of AI. One of the reasons why I joined Qure was before joining Qure, AI was a buzzword for me. I'm a computer engineer. I have studied AI. But looking at a very large practical application, I haven't worked in AI, since my graduation. I was very much interested towards Qure because this was an organization which was implementing it and it was actually creating impact. So just looking at AI from a very theoretical point of view to seeing, it impact people's lives daily, it was very inspiring for me. So healthcare has been an early adopter and we were creating impact, like we were saving lives using AI way earlier. Like from 2017, 2018, when we did the first, deployment at Qure.
Wow, that is amazing. What I'm curious to know is what has the level of adoption been like globally versus in India? If you could just help me with that.
So I have been looking at the public health space. I come from a development sector background and organically, I was more inclined towards how does AI help solve problems of the populations. To answer your question particularly, we are in a lot of low and middle income countries, whole of like most of Africa, most of Southeast Asia, Central Asia, India as well. I think Indian landscape is more mature. We have a more mature regulatory landscape than the other countries in LMICs. I will say that of course, AI was much earlier in the social media space, for example. So it was already there and implemented in the high-income countries. But if you talk about the low-income countries, we have a good ecosystem, a lot of startups who are working in AI in the healthcare space. But if you talk about the digital infrastructure, I think a lot of places in India share the same challenges with the healthcare infrastructure as some of the regions in Africa. So it's similar. If I paint a picture for you, limited and not sufficiently skilled healthcare professionals. You do not have primary healthcare facilities nearby, so people have to travel long distances. So we of course understood that technology can play a role in solving the healthcare challenges. AI under the realm of digital health technology plays a very particular role, particularly filling the gap of clinicians
Yeah.
playing a complementary role to the healthcare staff in particular.
Okay, so you mentioned that it's a complementary role. So I think from the get-go, what I've been very curious to know that is, there's been like a lot of conversation around AI replacing humans,
Yes.
right? And this has been across fields, right? Not just like healthcare, but of course, particularly in healthcare as well, because it's a field where you're always like, doctors are worshipped in a country like India, right? Almost. So when we talk about AI, is it a AI plus human intervention, or are we looking at an AI versus human intervention? So is it like a complementary thing like you mentioned, or is it will they replace the doctors?
That's a great question, and always something
Yeah.
which people ask us
Yeah.
when we go to the field. So essentially what we've realized is that AI is, at least at this stage, is not out there to replace humans. It definitely plays a complementary role, and we've done a lot of evidence. Like we've seen how does AI perform within a hospital, within community settings. We've seen very good evidence in terms of how is it a value addition, how does it adds to the diagnostic accuracy. So if a doctor is using AI, they're able to find missing cases which they may not have found when they are evaluating those cases independently. Or there are certain tasks which can be automated by AI, and then you draw the attention of the clinician only towards high risk cases. So, for example, what we do, one of the things which our chest X-ray AI tool does is, from thousands of X-rays, it is able to classify which of these are abnormal and which of these are normal within minutes.
Okay.
Now, if you have only like a limited doctor, or a radiologist supporting during the emergency times, maybe outside the daily hours, they only look at high-risk X-rays. So then you just identify that these people are at high risk, these are abnormal X-rays, and then you have a human reader read them. And then you kind of, just maybe have like an oversight on the normal X-ray of sorts. So it's not replacing human reader, but it's making their life easy. It's reducing the workload.
Yeah.
It is improving, it's helping in faster diagnosis. So maybe let's say the radiologist or doctors are taking days to read because of their workload.
Yeah.
AI will give you results within a minute.
So is it like safe to say that it's a really efficient assistant?
Yes.
Yeah. Okay. What's so far our conversation has mostly revolved around the diagnostic aspect of it, right? Like the preventive care, if I may say so. Is the focus also on the cure aspect of it? Is AI also curing patients?
So again, AI can act as an aid. So we are not in the curative aspect as of now, but yes, there are a lot of healthcare technologies, organizations out there, academic research happening where what is the best cure, for a certain disease, looking at biomarkers, looking at patterns. So what AI does really really well is it can interpret and identify patterns among humongous data, which humans might take a lot longer to do so. So it will help you come up to those solutions to finding which biomarkers you should test very, very quickly. So helps in kind of prioritizing, makes that entire test use case much smaller. So yes, definitely AI has been playing a role across the patient journey in identifying who should we support, which patient is more likely to kind of fall off this cascade. They may not complete the treatment, to diagnosis, to particularly identifying which treatment therapy or option might be better for a patient.
Right. So this is something that I'm personally very interested in. And this might be like a slight detour, but so for instance, a friend of mine, and I mean, you weigh in if this sounds completely, off track, but so for instance, a friend of mine, his dad has been recommended a surgery wherein a robot is going to conduct that surgery, right? So this falls under the category of like AI conducting a surgery, right? And this is relatively new in India, right? So it's just like, I think the earliest surgery for this was done 10 years ago. Now, his biggest concern over here is that something that came in just 10 years back, not a lot of people have been through these treatments, how do I trust my dad's life with something like this? So this is like, I think, the number one challenge in my lens as somebody who would go to a hospital as a patient. That would be like my number one concern.
Right.
How do you address something like that?
Right. So I think the AI regulatory ecosystem is kind of still evolving in India. It depends on which geography you are in, which device is this.
Yeah.
So I mean, I think a couple of things. As an individual, as a patient, you would want to see what kind of research evidence is there, what kind of studies are there. I know that this seems like like if I have to do like a complete research, go into the research papers, it seems very cumbersome. But I think that is an approach which I would follow.
Yeah.
I would see what kind of FDA certifications, what kind of regulatory approvals this technology has. Are there, are there any statistics, research available about its performance, any kind of side effects, things to keep in mind. So when you, for example, what are certain caveats which you would want to keep in consideration? I think the second thing, the easier thing to do is ask all these questions to your clinician. Right. I mean, please go and have a very very candid discussion about pros and cons of using this technology, risks of using this technology. And I think the clinicians and the healthcare providers have to take responsibility in this case particularly.
Right. So this is something that for sure, a patient who's perhaps going for one of these procedures can do their bit of research. But in terms of the other lens, the startups who are working in this space, the other stakeholders involved who are building this technology, are there things that are being done to build the trust amongst the community from that lens? Are things happening? And if yes, what are some of those things?
I think this is a great question. I think all of us, all the different stakeholders are learning in this ecosystem, and we may have examples from the West, but they may not be customized or applicable to, let's say, an Indian context or a context from a low and middle income country. So there is a lot of stuff which is where we are learning. In terms of the trust building between with the end user, there is a lot of awareness which is needed. Awareness about things to keep in mind when your results are being processed by an AI technology. What kind of questions do you ask the clinicians? Is there a way to opt out? How would this data be stored? To whom will this data have be accessible to? Is this technology appropriate for somebody with your demographics, with your comorbidities or not? So again, I think it starts with awareness building. Of course, the government and the public stakeholders are responsible for a general governance of these technologies. But as a technology provider, I think the private technology providers also should play a role, if they are engaging directly with the patients or the end users.
Right. And is there just out of curiosity, is there a sense of resistance from the clinicians as well, or from the doctors as well for the technology? Because it's new.
Yes. So I think there's a lot of apprehension, particularly because there's lack of understanding. And there's also this fear that this will replace the clinicians or, the radiologist for us there is. But I think we've done a lot for that. We've actually worked with the clinicians, showed them, how AI has able to generate value. So after you kind of do this trust building exercise where you are able to, show them simple metrics that let's compare, your standard pathway, what you have been doing without AI, and let's do that after AI. Are you able to increase the number of people you are diagnosing? Is the time reduced? Has your workload reduced? So we do this a lot with the clinicians. We do a lot of capacity building. And also there's a lot of case studies to see this happening at scale? How many more people have we diagnosed? So I think that has helped quite a bit in kind of bridging that gap.
Yeah.
And I think even within the clinicians, it is becoming very evident that there's a very famous, I mean, we always debate about this, that AI will not be replacing the clinicians, but clinicians who understand AI will be replacing those who will not understand or who will not use AI. So AI is coming. It's I mean, there's no two words about it. It's best that the ecosystem prepares for it so that we can actually harness the use in the most impactful manner.
Yeah, like you have to adopt and adapt with changing times. Like that's the only way to move forward. You mentioned case studies. I'm very curious.
Yes.
Do you have like a story, a case study of any, a person or a group that you conducted this on that you would like to share with me? Like
lots of them, very interesting ones. Radiologists are experts who read chest X-rays and CTs, and there are not sufficient radiologists in low and middle income countries. So what happens is either you go to an expert doctor who will take their own time and read these chest X-rays, and chest X-rays are important for tuberculosis screening. So if TB, like there's a huge TB burden, and globally we are trying to eliminate TB by 2030. And there's a huge push by the government to go and find the TB cases, screen them, diagnose them, and then kind of put them on treatment. Now, because there is a huge gap in terms of radiologists who can read the chest X-rays, it used to take a lot of time for the chest X-rays to be read. So for example, you have a van which is going in communities and there is no radiologist. There are chest X-rays available. So you go and get the chest X-rays, come back, now find a radiologist, read the chest X-rays for 1 week and then go back and say that, okay, A, B, C, D people are TB presumptive.
Right.
Earlier, this used to take like a week, 2 weeks. When you go back to the community, the person is gone. You're not able to find them. They will, I mean, why would they leave their jobs, if this van may not go to that same place? Like think from a patient point of view, right? Now, AI is integrated with that X-ray machine. You don't need a radiologist. Now this machine in the mobile van goes to the communities. It goes to where you are. The AI is able to interpret the chest X-rays and it gives you results within a minute. So now you are able to tell the person that yes, it seems TB presumptive, and then you kind of bring them, link them to the care there and then. Now this gap of like a week is reduced to 2 hours, including the TB diagnosis. So this was very, very powerful. And we do this work in Philippines, in South Africa, in most of the countries. And I mean, imagine, we also work with ultra portable chest X-ray machines. So X-ray machines which can be carried, which has really been a game changer, because imagine people going with a suitcase, setting this up in a very remote shed next to you, and then it has really kind of changed along with the AI, how TB diagnosis happens, and also the speed. Another very, very interesting work which we have done in India.
Can I ask you a question before we lead to the next case study? So you said that you go in these communities, and especially in Philippines and South Africa, you mentioned. Is there a sense of, when you go in with these portable machines or these vans, before you actually start the diagnostic process, do you have some sort of a process or a mandate in place where you kind of make people comfortable, make them understand what's going to happen? Like, is there something there between your van going to the community and that process actually starting?
So we are a technology provider. We work in all these settings with governments, with population health programs. So they are running this project essentially. So for example, in South Africa, we work with the South Africa Ministry of Health. So they have a lot of vans which go in vulnerable sections, and then of course there's a huge there's a whole program about creating awareness, when the vans are coming. There is a nurse and navigator as part of these vans who are guiding the patient. Somebody is doing community mobilization. In terms of how the end patients perceive the value of AI in this case is they're able to see how fast their results are, that they get the results on the same day. Earlier they had to follow up or they will just get lost by the, missed by the system. So I think from their end, they're able to get the results ASAP. They're able to get linkage to care ASAP. In terms of whether these results are being processed by AI or not, we may or may not, depending on, the programs we work with, want to, communicate that to the patients. A lot of times we take consent. So we are informing them that yes, they might be, read by AI, but of course, the final diagnosis depends on the clinician. Because as an AI, we are not able to give the results and which are directly processed. The clinician has to take a final call after.
Right. So this is like in the most layman terms, like if somebody comes to take a blood sample, that person is going to give me a report and then I have to take it to a clinician for a final diagnosis.
Exactly. So what it does is the chest X-ray interpretation is done by technology, and the technology says high risk. After that, the next steps are done by the doctor. In case of certain diseases, this is automated, where the doctor doesn't have to play a very critical role. The entire pathway is a part of that is automated and made very easier with the AI.
Okay. Wow. You were going on to some other case study that I kind of cut off midway. So if you could just tell me about that also.
Yeah, this is very powerful. So we actually worked with Mumbai Municipal Corporation hospitals. These are secondary hospitals, like smaller hospitals. Some of them have chest X-ray machines, some of them do not have chest X-ray machines. And a lot of people in Mumbai, particularly from lower middle income strata, they come to these government hospitals. What we did was, there are a lot of chest X-rays which happen in these hospitals. So because of multiple reasons, somebody is coming for signs of tuberculosis. So of course people, or somebody has a cough and the doctor says go and get a chest X-ray done, or somebody is getting an insurance done, or the employers say that from a yearly health checkup I want you to get a chest X-ray done as well. Or you fell and you had an abdomen injury and the doctor said get a chest X-ray. So chest X-rays are happening for different reasons. We integrated AI within the main chest X-ray machines in these hospitals, and we were able to find additional up to 30%, 35% TB cases which were missed in the hospital because nobody is looking at all these chest X-rays for TB. This is so commonsensical, right? I mean, you assume that you're going to the hospital and your doctor recommends a chest X-ray for one particular reason. So obviously TB will be flagged as well, but no. So the AI flags signs of TB, and then we automatically send alerts to the TB clinic that there's this person in the hospital who came to get a chest X-ray done today, and they might have TB. So let's maybe go and get a sputum test done. So around 35% of them were incidental, which means that they would have been missed if not for AI. So this is very interesting, and this is what we were presenting to the Prime Minister, because we said that even if we just consider all the hospitals within the country, just having an AI helps in increasing the notification, because you're able to find the missing cases. You don't have to do any screening. You are not putting in resources, but just look at your existing health systems. And second is link them. The second part was actually working with the TB staff to follow up with these patients, because that's also weak. They're already burdened. So how does your technology helps in right alert at the right time, making sure that this patient is not lost? Because if AI says TB presumptive but nobody follows up, is the other part. So it always has to be technology plus the human aspect for actually solving the challenge. You cannot completely also rely on AI itself.
Right. You mentioned the Bombay Municipal Corporation and partnering with them for this particular case study and research. So, see, you as a startup are doing a lot of really brilliant work in the AI space and in the digital health space. But in a country especially like India, जहाँ पे छोटे छोटे गाँव कस्बों में लोग रहते हैं जिनको शायद knowledge भी नहीं है about healthcare, and they're not literate around the digital health space. There are obviously multiple stakeholders involved, right? Can like a startup just go in and be like, I can change the landscape? A, part one is that. B, if no, who are these different stakeholders involved? I'm assuming government is one of them, but I would love for you to talk more about who are the different stakeholders and perhaps how involved are they at this current moment?
Sure. So I think, it takes a village, to create change. So everybody, we work with the governments. The government stakeholders at different levels. If you're working with the government hospitals, of course, the government staff. If you're working in TB, there's a whole kind of, there's a district TB officer, state TB officer. They are kept in loop. The ministries of health at a government level. Ministry of Health more in terms of ecosystem building, setting up, kind of a governance framework on how different private technologies can work with the government hospitals, government community settings, NGOs. So if the NGO is running a TB screening program or a lung health screening program, where does technology fit in? In terms of private partners, we of course are a private technology partner, but there could be corporates, who are supporting with their funds. Also other stakeholders like pharma, for example.
Yeah, of course.
So pharma is a huge partner. For example, pharma companies do a lot of, support for example, we have a global partnership with AstraZeneca where we support them in innovative models for lung cancer screening. And again, the same tool can identify 35 to 40 different findings, including signs of TB, lung cancer, heart failure.
So this is a single tool that's identifying multiple...
Yes,
oh, wow.
Yes,
okay.
Yes. It has multiple FDA findings. It is one of the first in the world for an FDA certification for lung cancer. It is one of the tools which has been recommended by World Health Organization on use of this tool in the absence of a human reader, which was huge. That WHO came with these rules that you can use an AI solution in the absence of a human reader. So we were one of the 3 technology companies, and after kind of independent evaluation of how does our AI algorithms function, perform for TB screening in different populations, in different with different demographics, they kind of finalized 3 technologies, which was big for us that this tool has good performance, as good as or even better than some of the clinicians and the radiologists. So
getting approvals from a WHO and doing such amazing work, it really brings me to this one question, that what is the accuracy of this technology?
So I think a very, very interesting question. Whenever the policy makers, WHO, whenever they give recommendations, they do kind of independent evaluation studies. They look at, people of a mixed cohort, people with certain abnormalities, people in different age groups. Do you have sufficient men, women, different, gender representation. And then they check how does AI perform, in finding a particular disease. So our accuracy for detecting TB is different than our accuracy of detecting other findings. And they check this as compared to gold standard. So in the absence of AI, how do you diagnose for TB? You diagnose TB using a sputum test, a confirmatory test. So and you also diagnose alternatively on a chest x-ray. You do clinical diagnosis of TB. So you see how good is the AI able to detect TB cases. Is that good enough, equivalent to a clinician? Or if AI plus, a clinician is better than as I was telling you, a clinician not using an AI. So depending on all of these different use cases and depending on the accuracy of AI, then they have their recommendations. Then they have recommendations for the entire health ecosystem on how do you rely on AI solutions? How do you process their results? And then there are, of course, a lot of caveats also. This is healthcare, so you cannot completely blindly rely on AI as well, because you touched upon the aspect of accuracy. So So whenever we generate reports, when we have to comply with different standards and certifications, we always have this disclaimer, that the clinician is the final decision maker. The final decision about the next step in the patient journey has to be decided by the clinician or the radiologist or the expert, and this is an aid to the clinician AI. So this is something which we of course mention. Yeah.
So is there like a percentage that you can share with me that, okay, it's this % accurate usually?
So generally we have different sensitivities and specificities going in the artificial intelligence lingo. So it depends on TB for adults, TB for...
Okay.
So whenever we deploy, so we do this training, we do this orientation, like you mentioned, right, with the clinician, with the healthcare worker on how do you interpret AI results, what is the accuracy which we are quoting, then we work with you and see what the results are. If there are a lot of changes in the results which you are seeing, then we adjust the algorithm thresholds. So when to answer you, there's no one response. It has performed in a particular settings. There's also a quoted range that we mention for each finding. So for TB, I will say about a particular number. For adults, for children, for lung cancer, I'll have different findings and so on. Yeah.
It really, like you mentioned, it really does take a village because there's so many people involved, like right from the patient to the government to the technology providers, to the clinicians, to just like everybody working at a hospital. Like everybody has to be involved for it to actually, get somewhere. So tell me, like, I'm sure there are multiple challenges, but what is that one single most challenge that you think is becoming like a hindrance in some sense for the growth of AI? Like, is there like one thing that you can tell me?
I think the most important one, and this is like a cumulative of all the different reasons, is understanding and the apprehensions. So I think if the governments have apprehensions about the AI can also have an exploitative effect, or AI might have data privacy concerns without understanding the technology or without having a governance standard, I think it's very limiting for different innovators and technology providers to implement and adopt it at scale. So I think everybody has to come together, work on like an enabling environment, and then see how do we kind of build a good governance framework for AI to be adopted at scale.
Right. So we touched upon lung cancer, TB, and are there like more diseases that you can cure through this single technology? And my second part to this question would be that, is there just one tool that you have built, or are there like multiple tools that you built across multiple diseases?
So we have multiple solutions. I was talking to you about our chest X-ray AI interpretation tool. We also have interpretation tools for chest CT. Again, for identifying signs of lung cancer. We have tools for identification of neurocritical disorders, strokes on head CT. And musculoskeletal X-rays. We are able to identify fractures. And all of these different AI modules are a part of our digital health platform, because patient might be coming with multiple diseases, and if you are giving these solutions to the healthcare providers, they might want to look at this comprehensively, mapping the entire patient journey. So if they want to take chest X-rays, CTs of the same patient, and they want to compare results, that's also possible in this digital health platform. Let's say a healthcare worker wants to coordinate from the field to the doctor who's in a tertiary hospital, to an expert somewhere else. They can also kind of coordinate and make very quick decisions, particularly in the cases which are time sensitive. For example, for stroke, you have to take quick decisions. So that platform, which we call, which is our digital health platform, has all these modules, AI modules, and then it manages the entire patient journey and also helps in care coordination between stakeholders at different levels.
At the risk of sounding slightly lame, for the lack of a better word. I want to ask that, so we've obviously been having a lot of conversation about AI and technology and going to the community and doing these chest x-rays. And now we're also talking about, neuro, diseases and stuff. So just from the look of it, like when we say AI, I mean, from how I see AI, okay, there's ChatGPT, so there's just a tool that you're kind of just putting in data, and there's like a lot of data.
Yeah.
Somebody's feeding it. I'm answering a question there. ChatGPT is kind of trained to look at the data and tell me results, right? So are we talking about that here as well, or is it like an actual machine? Say MRI scan hota hai. So is this an actual machine that kind of looks like how an MRI scan machine would look, or how like one of those chest CT X-rays would look?
This is a software.
It's a software.
Which is integrated in a machine because
okay.
our solutions are focused on image-based AI. So our
okay.
AI looks at signs of findings on images. It's based on computer vision, neural networks, and so on. So it's a software which integrates with the hardware devices. So it's not so it can integrate to multiple. That's what I was telling you, that another partner we have are the hardware manufacturers, or platforms which do tele-reporting, for example, teleradiologist, and we integrate with those. So this is a software which is interoperable. It can integrate with national dashboards, national softwares, the softwares which governments have created, for TP, for disease screening, and so on. But just on to your previous question, we also, another thing which we are very much excited about is also integrated disease screening, which I was telling you, right? If a patient is coming to you in the hospital with an injury and the doctor recommends a chest x-ray, I was talking to you about the case study for TB in BMC, but you can identify lung cancer. Right, the same solution is saying that this person may also have a nodule which is suspicious of lung cancer. And generally, the lung cancer is kind of diagnosed at a very late stage when people have symptoms. Otherwise, it's very difficult to diagnose lung cancer earlier, particularly in low and middle income countries. It's diagnosed on CTs. We do not have a lot of CTs in the under-resourced settings. So you are actually leveraging chest x-rays, and you're also doing like a lung cancer diagnosis. So anything and everything which can be found incidentally, like just by coincidence, because the AI flagged this, now automatically it is prioritized by the doctor to review, what doctor takes the final call. But so
wow. So essentially what we're saying here is that something that could take up to a week also to just diagnose. Somebody's suffering, they go to a doctor, and now the doctor's trying to figure ki kya issue hai, right? It's like finding a needle in a haystack. Here comes AI, and AI can actually screen through, if you're looking at chest as a body part, it can screen through your chest, and it can tell you that, hey, there's A, B, C, D, E, and it can screen through everything all at once rather than going for A first, B first, C then.
And you may not have symptoms also.
Right.
So I am going to the doctor, I do not have symptoms for lung cancer. It was just like a cough or something, I mean, cough is a symptom. Let's say, I just had an injury and the doctor recommended a chest x-ray as well because, maybe I had an abdomen injury. And then it just, it's flagged. What it does is, it goes to the clinician. The clinician evaluates whether this is an actual case of, like a suspicious nodule. They put you to the, right pathway. They connect you to the right pathway. So now they will recommend whether you need any further diagnostic test. This pathway would have been completely missed if not for AI. And you are diagnosed on a, let's say if you are diagnosed for lung cancer through this pathway, you are diagnosed way earlier. Which increases and improves your survival rate.
Of course,
because you didn't have any symptoms for lung cancer. So there are also a lot of cases where for TB, which we would have been missed if not for the chest x-ray.
Commendable. In the previous answer, you actually briefly mentioned that, and we've also touched upon it slightly, but I just want to quickly touch upon it again. You mentioned low income, middle income countries versus like developed countries. Can you quickly tell me how far advanced is this technology in like developed nations versus like a low income or middle income country?
So our technology is used in high-income countries as well.
Okay.
The use case of how it is used is kind of different. There might be more radiologists available, more resources available in high-income countries. There, they use our technology particularly for reducing workload or like improving time for reading or improving accuracy. So if they're reading the chest x-rays, how does AI help in improving the accuracy? As compared to low-income countries, there are no radiologists. So the value addition by AI is humongous, in a kind of overburdened health ecosystem.
Yeah.
So as I was telling you that you can find up to like 30-35% incidental cases for TB in a low-income country. One of the interesting things, which I come across when I meet government stakeholders from Africa or some of the states in India, is they're very resistant and very apprehensive about AI, and they say that we do not have a computer or we do not have an electronic medical record system, and you're talking about an AI software. Or I mean, they may have computers, but they are not like sophisticated computers. So a lot of times when I go to them and tell them that AI can actually work on your mobile, it can work in an offline setting if you do not have good network connectivity. We as an organization, because we work extensively along in the public health space, we've actually devised how do you make AI work in such settings. How do you make AI work with poorer infrastructure, with not so sophisticated computers. I mean, there are different kind of solutions which are available. So even in those scenarios where you do not have very good digital health infrastructure, it's completely possible to integrate these solutions. And we have learned how to do that. We have learned how to deploy in some of the most remotest of settings. A lot of times people come and say that these are all digital X-ray machines. Earlier, we used to have these film-based machines. So, you get these X-ray film and you do not have a digital image of that X-ray. Now you will see a lot of X-rays. So we actually created a mobile application where, if a physical film is taken, you can take a picture of that and you can identify findings on your mobile application. Because there are so many places where you do not have a digital X-ray machine. Now, of course, I mean, the AI runs on the image. So it depends on how good, the image is taken. So we have those caveats as well. And we do a lot of training, of the end users. We explain to them how to take pictures. And we also, so we use both technology to solve for it, which means that we also did something interesting. We trained the AI to identify what is a good image versus a bad image. So that, it starts rejecting. These are the cases where you are, this is healthcare. So you cannot make mistakes, as compared to a use case where you are showing preferable ads, for example, based on certain choices. In healthcare, you have to be extremely careful because every decision, every output will impact somebody's life.
Wow. We've spoken about impact, and we've spoken about impact at a very macro level, right? Where you've spoken about going to communities, or we've spoken about low-income countries versus like high-income countries. I'm curious to know that, is there like one single person, like if we just take like a completely micro lens, is there like an impact story that you can share with me of just one person? Do you have just somebody from maybe a Bombay or South Africa or the Philippines that got impacted through your technology and saw results in their lives? Do you have
from a patient?
Yeah, from just like a single patient POV. Do you have like a?
Yes. I think many of them. So there are cases. I mean, as I mentioned to you, who would not have diagnosed with TB, or wouldn't have completed the treatment. If not for the AI solution, right? This is tuberculosis. I also mentioned that we work in the stroke space. We work in the lung cancer space. There have been so many people we have been able to support screening for and then diagnosis for who would have been totally missed, if not for the AI solutions.
Okay, amazing. We've spoken about the challenges in the space. You've spoken about the impact in the space. Want to know about what's exciting, what's next in AI? Where do you see it, say, 10 years down the line?
So I think there is so much happening in the space of AI. There are so many interesting use cases that all of us are kind of learning about, and also figuring out how, as a technology partner, how do you kind of incorporate that into your solutions? Which means that we are also thinking about, are there new healthcare problems, that can be solved with the use of AI? Can we, as a startup with AI as an expertise, and we have a whole bunch of clinicians and data scientists who can work on creating these new AI solutions. So that's one priority, looking at what are the healthcare challenges, particularly in the public health space. So something, for example, we have been exploring work in cervical cancer. How can AI help in early cervical cancer screening? So that is one thing. Second, also the generative AI part of it, right? As of now, we are looking at multiple findings on the images, and then we detect, that this could be an abnormal finding. If we are also able to capture the text, for example, within the hospital, certain information was captured about the patient, their age, I was telling you earlier, the demographics, HIV positive status, for example, other comorbidities they have. If we are able to capture that using NLP and then combine that along with our imaging data, does that help in improving the accuracy? Does that help in finding interesting results or trends about certain form of diagnosis, certain form of treatment actually happening or not? Or how does AI perform in females with signs of TB above 45, for example, going to very specific questions. So I think in the future, we will be going towards more of such specific use cases, leveraging multiple sources of data beyond images to have a more kind of precise and more accurate diagnosis, or generating information with the use of AI.
Well, Sanya, you're clearly on your way to creating a revolution in this particular industry. And which brings me to, we have spoken a lot about AI and technology and what you're doing. I want to know about your journey as well, as like a young woman in this space, a young leader in this space rather. What have some of your experiences been like working in this industry?
Sure. So I think, interestingly, I haven't, unlike some of my peers, I mean, I haven't been in healthcare all through. I started, after the Young India Fellowship, I was working with CIPLA, and I started my career in healthcare, and then kind of ventured into livelihoods space a little bit, circular economy. I have always been passionate about how do you create impact at scale, and also kind of make sustainable models. Like, you have a very strong economic fundamentals when you are creating impact. The sole reason being that I feel that if something is economics, and if there are alignment of priorities among different stakeholders, it's more sustainable, it's long lasting, which has always been like a huge problem to solve. It's not easy. In the healthcare space, I joined Qure particularly during the COVID times. So naturally, I mean, was very much interested towards healthcare during that time, was personally impacted. And when you see the health systems kind of, like falling apart during an emergency, it has even a more of a deeper impact on you. And as I was telling you earlier, that for me as an engineering student, AI to an extent was a buzzword. I mean, of course, I had studied about AI, I had learned, but I didn't get a chance to implement it, during my career. So I think this seemed a very interesting space for me when I joined Qure. This was artificial intelligence, this was healthcare. I had already worked in the healthcare space, and more importantly, it was public health, which is very close to me personally. That how do you use AI to solve problems of the under-resourced or the most disadvantaged? So I kind of worked in Qure, and I started in the client success team. So I was actually deploying these solutions. In Africa and in Philippines. And then I kind of moved on to strategic partnerships, innovation. Now that we have so many learnings, we have learned how to deploy AI in remote corners of the world. How can you build more solutions which are impactful using AI? What new problems can you solve? How do you partner with some of the global leaders? Our expertise has been AI. Our expertise has been how do you take technology to the, some of the most like literally on the ground. How do you leverage this expertise in solving new problems is something which I've come to now. So my role has transitioned to looking at innovations and partnerships for Qure. And it has been a great, huge learning personally.
What drives you at a personal level though to dedicate all your time to this industry and this space? Is there something that is driving you personally to be so at it all the time?
I think besides, of course, the fact that you get an opportunity to really implement artificial intelligence. I think the fact that you are able to create change at scale. This is like each day we screen people out there. We are screening like millions of people. So I think the interesting opportunity and this platform that you are able to reach so many people around the world, it's very exciting. At the same time, a lot of responsibility, for us, that this is the power AI has, and we at the, behind the stage, we can what kind of decisions we take each day. Each of these decisions at the end generate like an impact for somebody in like Fiji, in Uzbekistan, right? Which is extremely powerful. And also I'm very grateful, for being at this stage, working at the forefront of AI. But otherwise, my journey towards impact has always been, of an enthusiast. So I started working with not-for-profits and, working with the corporate foundation, was working with CIPLA. And it was full of curiosity, what are the value systems of clinicians? What are the decisions which a patient takes, when they are going and seeking care? As a patient myself, what are the questions which I have? How do I build trust with the care providers? How do I, how do private sector plays a role in the healthcare ecosystem? So my journey starting with CIPLA was full of what role different stakeholders can play. And then as I was telling you that I'm somebody who's very passionate about collaboration. So for me, throughout my career journey, it has been how do you align interests, of a private stakeholder with what is the problem that a government is trying to solve? How can a non-profit come in and deliver, this intervention on the ground? And then how does each stakeholder identify the strengths of others and what are the complementary strengths and skills they bring to the table? And then that is how you build, a very strong, scalable, sustainable partnership, which has also brought me to Qure. And I, as we spoke about, every day we build these partnerships so that, we can actually reach some of the most disadvantaged.
Well, thank you for collaborating with YO.DH and sharing these really, beautiful, impactful insights with us. This conversation was amazing, and I had a great time learning from you. This brings us to our last segment, which is our version of the rapid fire round. It's called Rapid Dialogue. Are you ready for it?
Definitely.
Okay, first question. One quote that you live by.
If you have to go fast, go alone. If you have to go far, go together. I am very passionate about collaboration, and I think this quote says it all.
Oh, well said. Awesome. Okay, the next one is similar but still different. One life philosophy that has got you this far.
Experiment. Don't be afraid to try new things, to deep dive.
Yeah. One thing you'd want to tell young women aspiring to make a change.
I think be confident, be consistent, and as I said, try new things. Don't be afraid to experiment. Go out there.
What is the last thing you asked ChatGPT?
What is the quote which I should say?
What code do I live by, ChatGPT?
Don't put it away.
Listen, this is going. Sorry. No retakes here. One thing you'd want to tell young women aspiring to make a change?
I think we women doubt ourselves too much. And like I mentioned that feel free to experiment, to try new things, live for yourself.
Wow, that's great advice. And that brings me to, what is the best piece of advice you have ever received?
So from my mother, who's always encouraged me, to follow unconventional paths, don't be afraid of trying something new. She's always mentioned that, when you're very old, you should have an interesting life stories to tell your grandchildren. I hope I live to have so many grandchildren, but that has been very interesting for me particularly.
With all the innovations you're doing in healthcare, I'm sure you live to have lots of grandchildren. Okay. One app that you cannot function without?
Google.
Nice. Okay, that brings me to the end of our rapid dialogue round. And you have performed exceptionally well, Sanya.
Thank
so
you.
you deserve a hamper. Can somebody please bring the hamper for me? All right. This is from us at YO.DH.
Thank you so much.
Thank you so much, Sanya, for just performing so great with the rapid dialogue, but also for coming here and being our guest on this show and sharing all your learnings with us. I had a wonderful time. I hope you did as well.
I had an amazing time. Thank you so much.
Awesome.
Thank you so much.
Thank you all for watching our episode. And if you want to know more about YO.DH and what we're up to, we have shared a lot of links in our description. Please do read up about it. You can become a member of our community. We have lots of fun events, panel discussions, and we are creating a lot of impact in the digital health space. So you would want to be a part of this community. Thank you so much. Please like, comment, share, subscribe, and we'll see you in the next episode. Thank you.